Bismillahirrahmanirrahim. So communication station growth chart to be described to medical student or parents. Communication station as constitutional delay of growth and puberty. First, the case is growth chart, and we have to tell about to the medical student. So, can just regarding the other recording, we know how to do the scenario with medical student, and just after that, just we are assessing the prior knowledge, how far you know about it, and then first of the question is what is the growth centile. So these are the growth centile. Yes, so the growth centile is, if we follow, this is the curved. Yes, this is the curved line on the growth chart that represent the range of the growth. Suppose, suppose we found in the child is in 25th centile in his height. That means 75%, if we take 100 children, 75 will be above this line and 25 children will be below this line. Okay. And now, so another question is, do you know how we plot in growth chart? So there is two axes. So this is x-axis for the age and y-axis. We can use it for the height, weight. Okay. And suppose the child is had the age 2 years, of 3 years, 4 years, and this. So if this is the weight and this is the height, so we will take to a scale, and one is the we will keep in the vertical, and another scale what is the actual height is. Now suppose the height is 140, we will take this, and when this is cutting this point, it is the actual curve for this chart. Okay, and suppose we find this is on the 50 centile maybe. Okay, and now the thing is that what is mid-parental height. Okay, just I'm removing it. Okay. And mid-parental height, just okay. Mid-parental height, it is the we will take the we have a mid in new growth chart RCPCH. There is mid parental height comparator. This is that. Suppose I'm zooming it. Yes. Suppose here we found that, yes, so we found that father's height is 170, okay, and mother height is 150. So we will join it, and we can see that the mid-parental height is crossing at around, we can say that 27th or 27th centile. Okay, and between okay, not the 30th centile, between the 27th centile. Okay, then the thing we have to do that we will calculate is it is what is the mid-parental centile. It means that it will be above 2 centile and below 2 centile it will be normal. Just I'm coming to this. Just suppose it is at the 27th centile. Okay. Then the thing we will do, yes, we will take the child's height. Suppose the child is now 10 years and his height is, suppose it is 140 centimeter. So it corresponds to the fourth centile. Suppose the normal, we can take that it is ninth centile or 25th centile. So from the suppose it is the child had drawing this. Okay. So the child suppose now in 25th centile, and from the parent height comparator, we found that mid-parental height is 27 centile. That means 2 centile above 27, main page is 2 centile above and 2 centile below. That means it is 2 centile above this and 2 centile below, means we can take this 25th centile and this 9th centile. So 2 centile, the child mid-parental height is between them. So if we go through it, and if we go through this 9th centile, yes. Okay, and the child is between them. This is the mid-parental height. From where we get it? Adult height, parental height comparator. When we join, we found that it is on the 27th centile. So 27th centile is here. We take 2 centile above and 2 centile below. This is the mid-parental height. And our child now 10 years, he is at the within this mid-parental height. Okay. If the child, suppose below this, his height is 130, so that it means that he is below the mid-parental height. I think it is clear now. Okay. Another thing I'm telling, this is about the adult height predictor. Okay. So remove it. Okay. So adult height predicted is that, yes, suppose in our child is now on, suppose is now on 9th centile. Okay. Yes, so he is on 9th centile. So in adult height predictor, is said that he will be 6 centimeter above and 6 centimeter below. So 170 plus 6 is, and minus 6 is 162. 168. Okay. So range is, he is expected, his height is 168 to 176. I think it is clear now. And now I have answered. So how to we can predict the adult height from the growth chart? What is MPH? And another thing is that here there is, I'm just removing it. Yes. Yes. And there is the thing is that sometimes we get that between the central chart, yes, between the central chart, suppose our child is if we divide it, it is near the 1/4 of this. So we will take this line. He is supposed to this line. But if it is the midway between them, so we can say that he is midway between the 75th, 91st centile. Okay. Another important thing is that it is very important for the constitutional delay of growth and puberty. First, I'm showing you. There is a shaded area in the 9 year to 14 years of age. If any children is plotted in this area, It's very significant. Why it is significant? What we have to do it, I'm telling you. Yes, this line is very important. Suppose, yes, whenever the child is present in the zero point 0.4 centile in the 9 to 14 years, we have to examine the child. If he is in the puberty, prepubertal boy, that means the sign of puberty is not yet growing, but that means we have to this pubertal boy plotted in this area growing normally, but comparison with the mid-parental height and growth trajectory will assess the assessment or further assessment needed or not. Okay, but if in the why we have this, but if it is the child, suppose we found the child in this shaded area and the child puberty is achieved, completing the puberty or in the puberty, but his height is below that time we should refer the child. Okay, I think I'm just trying to understand this to all of you. Okay, now another thing is that, okay, another thing is that we have mentioned in the growth chart communication. I'm following the Ahmed Bakri book. Yes, here there's what is the growth central. I have tell you what is the triangular or the shaded area. Now I have discussed, and that what how we predict the adult height from the growth chart. I have described, and now what is the mid-parental height? I also described it. And now the another question is what is if the child is born preterm? Okay, for preterm we have another growth chart. Okay, I'm closing it. Yes, if the child is preterm, so we have to calculate this. Yes, suppose if the child is less than 37 weeks, so we will plot the chart, and when the child is reached, suppose, yes, here he is born at 31st week, and when she reached the 40 weeks, that time we have to come in the next chart. And suppose in the 31st week his weight is 1 kg, and at 40 weeks we found that his weight is 1.2 kg. 1.2 kg. Okay, from these 2 weeks we will, after 40 weeks we will come here and we will add this 1.2 kg, this. Okay, and then we have to calculate it. This is the preterm growth chart. Okay, another thing is that what is do you mean by central? I have described. Okay, and when a case of what is an indication of referral for the short stature, if it is crossing more than 2 centile, any growth chart, I'm telling any growth chart, it is crossing more than 2 centile. This is 1 centile, this is another centile, and the child is now over the 4 months of period, this here. So this is, we have to warn, this is the warning sign, and we have to refer it if there any familial concern, and so in this case we have to refer. Now I'm removing all this. Now the question is what is the communication station, and the scenario taken from me from the Muntasir communication book. It is the talk to mom of the boy concerned about short stature of her child who has twin female taller than him and just has the first period. Mom worried about her child's short stature and always bullied by his college. So here it is very important that bullying issue is there. So how can we do this communication station, just like previously I have described? So how we can start that. Mom, I came to know that you have some audit regarding the height of your child. Can you so how far you know that about this growth? So she may tell something, and then we will start that actually it is a temporary short due to the delay of the pubertal development. It's normal, and your child needs some time to start the puberty. Mom may ask why puberty is not a. Actually, the thing is that if you compare with a garden, every flower, lots of flower there, and they are healthy, and different time they will grow. Are you okay? Understanding me? Okay. And then she may also complain that yes, his puberty is not, but his height is also after is also below the age, because her uh, his sister is growing, they are twin. Okay, the first things is that whenever the puberty will started, he will have the catch up growth, he will uh, grow with his weight. Okay, and another thing is that girls puberty and growth starts earlier than the boys. Are you with me? Okay. And sometimes mom may say that will you please, because there is bullying issue there, can you prescribe some hormone to start the puberty, at least the puberty? Actually, whenever a child present with that his height is not growing, and then with presence of a doctor, and we have to examine the child. If he is puberty height is not growing as well as the puberty is not achieved yet, so that then we can do one investigation such as the x-ray to exclude that is there any cause behind it or not. But if he is in the height is not growing and his puberty is not started, so we can wait. That time mom can say that please at least give some hormone to increase the to start the puberty. Mom, I can find you are very much audit. So in this actually, and I'm not in the position to give the hormone. However, I can tell you that this hormone will close. There is soft end of our bone. It will close this bone so that the child would have started the puberty, but his height will not gaining the appropriate height that should be. Are you following me? Okay. And mom may ask, okay, can you give some growth hormone? I heard about in the internet growth hormone. I admire your knowledge. But the thing is that we have to give growth hormone in certain when it is indicated. And there is a lots of hazards of giving growth hormones, such as it increase the blood pressure, it may cause the blurring of vision, headache, and there is increased chance of blood sugar level, chance of diabetes is increased. For this reason, whenever we weighing the risk versus benefit, here the risk is more. Okay. But my child is finding bullying at school. I'm so sorry to hear about it. So we can contact your school supervisor, and after permission from you, and then we can talk with them how it sounds. Okay. And but I'm so much worried. What should I do? Yes, I can arrange meeting with my consultant for referring you to the hormone doctor. Is it okay? Okay, and then we will give some leaflet trusted website, and then I and the support group. I can by lots of boy who has the delay in the growth as well as the puberty, and ultimately they reach their height and started the puberty. I will link with this groups so that you can get the confidence. Okay, so the thing is that whenever we get any kind of the child with his height is low, so we have to do examine the child, and we have to do the mid parental height. And then we can say that how how what height he will achieve, and what is the predicted height he will, and is the familial cause, or it is the normal pattern of the growth. So thank you very much. Assalamu alaikum.